I was saying to Linda at the beginning, sometimes we get invited to launch service user and care forums and groups, and actually there are no service users or carers in the audience, and we think, right, okay, that's not an altogether great start, but delighted to see so many people here today. It must be nearly, I don't know, maybe 2 years ago, maybe longer, that Queen's and the University of Ulster both started to think around how they were going to involve service users and carers, and we had some conversations at that stage with people about how best that might be achieved. So really, really delighted to see that it has now come to fruition. And of course you might say, well, that took a long time, but actually, if you're going to get this right, it is going to take a bit of time just to think through how best to do this, how you're going to make sure that this becomes a worthwhile process for everybody who's involved. As I was sort of coming up, I was rehearsing in my head some of the things that I think are crucial when you're looking at a service user and carer forum, and I was really pleased then when I was watching the slideshow, and the things that I was thinking about were actually in the key concepts of the one that's planned here at Queen's. And they were to be meaningful and of value, to avoid tokenism, building on the examples of good practice elsewhere, and service users and carers as co-educators. All really important, and the things that we in our work over the last 4 years would completely endorse. In terms of the meaningful and of value, for us that is really about outcomes. That's really about the people who have been involved are able to say, because I gave of my time, and because I went to the meetings, and because I contributed my experience, I can see that we have made this difference. And that is really important if you're going to keep any sort of involvement vibrant and dynamic and interesting. People quite often say to us, well, actually, I've been on such and such a group, I can't remember how long, I can't remember ever seeing any of my experiences making any difference. So it's really, really important from the outset that idea of meaningful and of value is really embedded in the work of a service user and care group. Avoiding tokenism, again, couldn't agree more with that. The idea of inviting one service user and one carer onto a group, in our experience, has not necessarily worked. What really makes the best situation and the best conversations is where there are groups of service users and carers working together, and where they're facilitated to have the voice heard. So increasingly we as an organisation are moving away from people ringing us up saying, I'm setting up a group and I want to get the service user and carer voice into it. Would you like to nominate as somebody? And we say, no, actually, that's not what we mean by meaningful engagement. So the idea of avoiding tokenism, and it isn't always going to be plain sailing. There's going to be situations where, in this situation, where the School of Nursing and Midwifery are going to be really keen to do something one way. The service user and carers group's going to say, hang on a minute, don't really agree with that. And they're going to have to work together to get to a compromise where both people feel that whatever it is that they thought was the right way forward is achieved. And that requires trust. It requires capacity building, both for the people within the School of Nursing and Midwifery and for the service users and carers around the table. And I couldn't emphasise that enough. This is a new way of thinking, particularly for the School of Nursing and Midwifery. Building on examples of good practice, again, we have had some experience of things that have worked really well, other experiences of things that probably, if we had our time over again, we probably wouldn't do that. And we're really keen to share that information and that experience with, indeed, the School of Nursing here at Queen's, but also to anybody who is thinking about setting up a launch of service user and care group. And service users and carers as co-educators, I see Maeve McCann in the audience, so I can't let this opportunity go past and not talk about a specific piece of work that we did, where the service users and carers actually became the researchers in a piece of work around mental health. And again, that was a really powerful piece in terms of a specific piece. In this case, it was 7-day follow-up, where we used the experience that service user had. They became partners in the piece of research they became the researchers themselves, and we supported them. We got them the right support actually to help them to write up that piece, which is now in the system and influencing some of the work the mental health service direction is taking. Really powerful piece. Again, everybody learned so much in that process. And if it's going to be of meaning, if it's going to be of value and it's going to be meaningful, it's more than just saying we want people as co-educators or we want people as researchers. We really got to think about how best to do that and how to make sure that everybody stays in with that process along the way. So really, in conclusion, just to wish you good luck, to say we're there if you need us and we're happy to help and we're happy to stay in contact. We have a membership scheme that we've built up over the last 10 years. We have about 10,000 members, of which all are people who have an interest in some part of health and social care. Some people are service users, some people are carers, some people are just, well, actually I'm quite interested in that because maybe one day I might be somebody who might use that service myself. It has now become a really important body of work in terms of getting a public perspective on the delivery and planning for health and social care. If anybody in this audience would like to join, I have some leaflets with me today. So thank you very much, good luck, and looking forward to hearing from John. Thank you.